Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into diabetes in pregnancy, diet tips for healthy blood sugar. You'll discover practical, mom-friendly advice to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. This causes blood sugar to rise. If not managed, gestational diabetes can lead to risks like a larger-than-average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today's video is all about diabetes in pregnancy, diet tips for healthy blood sugar, so let's explore what you need to know to stay healthy. Eating for gestational diabetes means choosing low glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. For lunch, try a salad with grilled chicken, avocado, and quinoa. Quinoa is a great low glycemic grain that provides protein and fiber. For dinner, consider baked salmon with roasted broccoli and sweet potato. These foods release sugar slowly, avoiding spikes. Snacks are important too. Instead of chips, go for hummus with carrot sticks or a small handful of nuts. Aim for 5 to 6 small meals daily to keep blood sugar even. Portion control matters as much as food choices. Overeating, even healthy foods, can raise blood sugar. Use a small plate to guide portions. Fill half with non-starchy veggies like spinach or zucchini, 1/4 with lean protein like turkey, and 1/4 with whole grains or starchy veggies like brown rice. Avoid sugary drinks like soda or juice. Stick to water, unsweetened teas, or infused water with cucumber or lemon for flavor. Staying hydrated helps your body process sugar better. A good rule is to drink at least 8 cups of water daily, more if you're active or in a hot climate. Some signs of gestational diabetes might feel like normal pregnancy discomforts, but they shouldn't be ignored. You might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine, dehydrating you. You're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee is a red flag. Fatigue is also common. If you're exhausted despite resting, it could be because your body isn't using sugar effectively for energy. Blurred vision might happen too. High blood sugar can affect the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur. High blood sugar creates an environment where bacteria thrive. If you notice these symptoms, talk to your doctor right away. They'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Keep a journal of your symptoms or habits. Note how often you're thirsty, how much you're peeing, or what you're eating to share with your doctor. This helps with a better diagnosis. Even if you don't have symptoms, you can start healthy habits now. Walking for 20 minutes a day or doing prenatal yoga can help your body use insulin better. These are safe for most pregnant women, but always check with your doctor first. Let's talk about meal planning in more detail. Planning meals ahead helps you stick to a gestational diabetes diet. Start with breakfast. A balanced option is Greek yogurt with chia seeds, berries, and a sprinkle of granola. This mix has protein, fiber, and healthy fats to keep you satisfied. For lunch, a whole grain wrap with turkey, spinach, and hummus is quick and nutritious. Dinner could be stir-fried tofu with bell peppers and brown rice for a plant-based option. Snacks between meals prevent hunger-driven sugar spikes. Try apple slices with peanut butter or a boiled egg with cucumber. Batch cook grains like quinoa or farro on weekends to save time. Keep a food log to track how meals affect your energy or cravings. Apps like MyFitnessPal can help, or just use a notebook. Carbohydrates are a big focus because they directly affect blood sugar. Not all carbs are bad, but you need the right ones. Choose complex carbs like oats, barley, or lentils over simple carbs like white pasta or candy. Complex carbs have fiber, which slows sugar absorption. Aim for 30 to 45 grams of carbs per meal, depending on your doctor's advice. For example, one slice of whole grain bread is about 15 grams of carbs, and a half cup of cooked quinoa is about 20 grams. Reading food labels helps. Look for total carbohydrates and check serving sizes. If you're craving sweets, try a small piece of dark chocolate, 70% cocoa or higher, instead of cookies. Pair it with almonds to balance the sugar. Protein is your friend in a gestational diabetes diet. It helps you feel full and supports your baby's growth. Good sources include eggs, chicken, fish, tofu, and beans. Aim for 20 to 30 grams of protein per meal. For example, a 3-ounce piece of chicken breast is about 25 grams of protein, and a cup of cooked lentils is about 18 grams. Healthy fats, like those in avocados, olive oil, or nuts, also help with satiety and blood sugar control. Avoid trans fats in fried foods or processed snacks, as they can worsen insulin resistance. A simple trick is to drizzle a teaspoon of olive oil on your veggies for flavor and health benefits. Exercise complements your diet. Light activity after meals, like a 10-minute walk, can lower blood sugar by helping your body use insulin. If walking isn't your thing, try prenatal swimming or seated stretches. Even household chores like vacuuming count as movement. Aim for 150 minutes of moderate exercise per week, spread out over most days. Always listen to your body and stop if you feel dizzy or short of breath. Your doctor can recommend safe exercises based on your pregnancy stage. Let's bring this to life with a story. Meet Emma, a 30-year-old mom in her second trimester. She noticed she was thirstier than usual and thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted despite sleeping, she told her doctor. They ordered a gestational diabetes test, and Emma was diagnosed. She worked with a dietitian to plan low glycemic meals. She chose quinoa bowls with veggies and grilled chicken and swapped soda for sparkling water. Emma also walked 20 minutes daily after dinner. By delivery, her baby was a healthy 7 pounds, and her blood sugar was under control. Emma's story shows that early action can make a big difference. You can take charge of your health too. Managing gestational diabetes also means monitoring your blood sugar. Your doctor may give you a glucometer to check levels at home. Typical targets are under 95 milligrams per deciliter before meals and under 120 milligrams per deciliter 2 hours after eating, but follow your doctor's specific goals. Test at the same times daily, like before breakfast and after lunch, to spot patterns. If numbers are consistently high, your doctor might adjust your diet or prescribe medication like insulin. Don't feel discouraged. Medication is sometimes needed and doesn't mean you're failing. It's about keeping you and your baby safe. Stress can also affect blood sugar, so self-care is key. Pregnancy is emotional, and worrying about gestational diabetes can feel overwhelming. Try deep breathing for 5 minutes daily or listen to calming music. Talking to other moms in a support group, online or in person, can help you feel less alone. Apps like Expectful offer guided meditations for pregnant women. Sleep is another factor. Aim for 7 to 9 hours nightly, as poor sleep can raise blood sugar. Create a relaxing bedtime routine, like reading or drinking chamomile tea. Cultural food preferences can fit into a gestational diabetes diet with some tweaks. If you love rice, choose brown or wild rice over white, and pair it with lots of veggies and protein. For example, a stir-fry with brown rice, shrimp, and broccoli is both tasty and blood sugar friendly. If you enjoy Indian food, opt for lentil-based dishes like dal with a side of roasted eggplant instead of heavy naan. In Latin American cuisine, try grilled fish tacos on corn tortillas with avocado and salsa. Work with a dietitian to adapt your favorite dishes. They can suggest swaps that honor your culture while keeping blood sugar stable. To wrap up, today we covered diabetes in pregnancy, diet tips for healthy blood sugar. You learned about gestational diabetes symptoms, the importance of the gestational diabetes test, and practical diet tips to manage blood sugar. We discussed low glycemic foods, portion control, hydration, and exercise to keep you and your baby healthy. Stories like Emma's show that small changes can lead to big results. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any symptoms or tried these diet tips? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and pregnancy diabetes risks. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.